And welcome back to Dr. U, and I'm Dr. Noah, your host. And today we're going to talk about fibromyalgia, kind of a complex of different types of signs and symptoms, which we'll go through the list, which makes it difficult for the patient and a lot of times for the doctor that's looking at you. A lot of doctors like simplistic things. You have a problem with this solution, B, and equals good success. With fibromyalgia, it's called a syndrome. There's a multitude of different types of problems that are occurring, and in the allopathic way, they just start once again going down a road of giving lots of different drugs, as we'll talk about. The major criteria is having aches and pains for more than 3 months. Kind of difficult as we get older. That's kind of a common type of problem that people see after the age of 40 and 50. Chronic pain, so that could possibly get you into that area. There are 18 points that the doctor's supposed to be able to kind of test. They're tender, pretty common. You should have at least 11 out of 18 to put you into this category of fibromyalgia, and that was around with the American College of Rheumatologists way back in the 80s. And this is also to exclude other type of problems. Life is not very fair. You can have fibromyalgia and thyroid conditions, mitochondrial dysfunction. You can have lots of different types of things that overlap and make it even more difficult, and that's why really seeking out a health provider that he or she is really willing to spend the time, because once again, this isn't an easy one. This isn't where you come in with a strep throat and they give you some antibiotics and you go out and you get better. This is a complex thing. There's a lot of frustration, as I mentioned, both on the health professional and on the patient. Most of the patients I've seen in the past with great results in terms of helping them they've been doing this for like 10, 20, 30 years, going to different doctors. Some doctors a little bit more open and receptive. Other health providers just think that's all in your head. One of the issues here, it's quite a lot more women have this problem, so there's a whole gender bias that's been shown scientifically that when they have two identical actors coming in, one a man, one a woman, when the man goes in and explains all these problems, they have an organic or a physical problem. When the woman gives them exactly the same type of symptom complex and history, that's all psychological, it's all in their head, so there's a real bias there. Some of the other problems that overlap that, which can make it, once again, more confusing: sleep disturbances, headaches and facial pain, abdominal pain, irritable bowel, which we're going to talk about irritable bowel syndrome, which is by itself is a very devastating. Numbness and tingling, chest pain, cognitive disorders. That's probably the most disturbing. Fibromyalgia can be, what at least I've seen with my patient caseloads, are very type A personalities, high achievers, and this is the most disturbing thing. Aches and pains people can deal with drugs and other natural approaches, but when their mind starts to go, and you're a top professional, a top executive like that, that is devastating. They're not as quick, they're not as sharp, their recall isn't as good, and so that is really a real big problem. And you have what's called brain fog, quote unquote, where their brain is just, once again, fuzzy all the time. Their days of just being, very sharp and professional are gone. Environmental sensitivity, big growing type of problem where some people over time become more and more sensitive to food and different chemicals in the environment, so where they become almost totally lock-ins, where they just can't go out, they can't do anything. Their carpeting and floors and things have to be ripped out. I've had some real challenges there, helped them quite a bit, because their body has become so sensitized because it's broken down to, as factors we'll talk about, it's a real problem there. So that's a kind of different type of problem. Different reasons for fibromyalgia can be, some people think it sometimes can be due to viruses, toxicity, emotional stresses, adrenal function. Cost. Now, back in 1996, the cost was $7,401 per year. Now it's about $35,000 a year. So this is a very expensive disorder. One is seeing all these specialists. When you go see a specialist, whether that's a GI or rheumatologist, usually is the one that he or she classifies. Those office visits are $5,000 to $1,000 for 5 to 10 minutes, and so very expensive. That's a real issue in itself. So that becomes a problem in terms of cost. And that's what this whole website is for, is because people are losing their insurance, people don't have insurance, people who even have insurance, their deductible. I have a lot of patients now, they pay $2,000 or $3,000 a month, but their deductible is $5,000 a year. They they have to spend $5,000 before their insurance kicks in. I mean, that's just not kind of, plus the $2,000 a month that they're paying to be in the insurance program. So it's getting kind of a really kind of a crazy place. And so this particular type of segment of fibromyalgia, we're going to give you suggestions that have been shown scientifically to be helpful.